When you're a family caregiver and your loved one is in distress and needs medical attention, you just go, right? Like you just drop everything. That's your focus. You go. And sometimes it can lead you to a place of feeling a little bit stressed because of everything happening so fast, right? And once you get to the hospital, you're bombarded with like 20 different questions. They need this from you, that from you, so that they can best take care of your loved one. But your anxiety's shot through the roof, all this stuff going on. You feel like you're losing control, right? And it's a lot. I get it. I've been there and I have some easy solutions to help you. My name is Bethany Ratcliffe and I've been a family caregiver for the past 18 years. And at first, honestly, it wasn't the easiest thing for me. It was an honor and I wanted to do it, but it wasn't totally graceful. And so I've learned a lot over the last 18 years. And so now my intention, my hope is to share what I've learned with other family caregivers, my experience struggles, and the effective solutions that I have found to help you be the best caregiver that you can be, to make this easier for you and your loved one, and to really celebrate this caregiving journey together, because truly it's unlike any other job out there, right? So let me go ahead and share with you what I like to keep in my hospital go bag. So I started a hospital go bag after probably the 10th hospitalization that I experienced with my loved one. I just didn't like, feeling so scattered. So this was an easy way, a simple way for me to take back a little bit of control. And really, in this situation, I think we're all kind of trying to find that. Am I right? So go ahead, designate yourself a hospital go bag, and I'm going to share with you exactly what you should have inside of it. So the first thing that you should have in it is a notebook. So this go bag can be for the hospital visit, right? Or it can also double as when you go to doctor's appointments. So you have everything kind of organized in there. So in there should be a notebook. And I know I'm a little old school. I love pen and paper. I love to write things out. I will take the printed notes from the office visit and keep those as well. But I like pen and paper. So at every single doctor's visit, I have everything written down that the doctor has said, what we're gonna do next, what the plan is, right? And so it's all here. So when we are in an emergency situation, I can just grab this notebook, pull it out and say, well, you're right. Yeah, we did see the doctor 2 weeks ago, and this was the recommendation. This was the med change that occurred, okay? And so what that does is when you're organized like that, the medical community, they kind of look at you a little differently, like, oh, wow, you know what you're talking about. We can really trust you and use you as a resource so that we can better take care of your loved one, right? You're more organized, you're pulled together, you have the information, it's all right here. Easy. I love that. So keep a notebook. The second thing that you're going to want to have on hand, and in this already done in this bag, is an updated medication list. Okay, this is super important. Rather than trying to recall the medications that your loved ones are on, or even if they're in the system with the hospital you go to, is the system up to date? I just had a ladybug land right on my glasses. That is, I think, lucky, very lucky. Okay, so having that list, and if you're like, oh no, do I just scribble that on a piece of paper? Don't worry, I have for you a medication list, the perfect one, everything you need on it. It's all very organized. I have that download for you, and you can get that over on my caregiver blog. It's www.bethanyratcliffe.com. and you can find it there under the resource tab actually. So go to that. So let's move on to now the third item that you would need, and that is going to be any special medical supply. So I want you to keep anything that's specialty, keep that in this bag, okay? So I'm talking about if there's like a special catheter that your loved one uses. That's maybe not a standard catheter. Stoma appliances, anything that's unique to them that the hospital wouldn't regularly have on hand, you're gonna wanna have that in there, because I'm gonna tell you that I've waited lost time in the ER while the hospital ran around like crazy people looking for the right supplies for my loved one. And that was an hour of lost time, an hour that they got sicker and sicker. It was awful. It was so defeating. It was terrible. So I've learned my lesson. Have your supplies in this bag as well, okay? Number 4 is just being ready, being prepared for them to have to stay the night. So you want them to be all set up if you can. So in your hospital go bag, have maybe if they have, if they utilize, incontinence underwear, have that in there, because chances are the hospital doesn't have the same that they use, and that can just be really annoying for your loved one. Also, any overnight drainage bags that they might need, have that. Compounded medications. And so obviously you're not going to be able to keep your compounded medications in this bag at all times because you use them. But if you're able to either grab them on the way out the door, so maybe have like a little checklist in the bag, stuff I need to grab on my way out the door. Or if you could keep a couple of them, or in a separate pill bottle and keep it in that bag, then that's already there ready to go, if that's a possibility, because the hospital pharmacy guarantee you they're not going to be able to get those compounded medications for you. And if it's something your loved one needs and you have to run and go back home, and depending on where you live in the hospital, it can just be really, really tricky. Not to mention you're exhausted at this point, let's face it. If you can, grab their CPAP or BiPAP machine on the way out the door. Again, having that little maybe checklist inside your hospital go bag would be really helpful for that and reminding you. All right, so that's for them. That's for your loved one, what you need to do so that they're best prepared, so they're getting the best care that they can. Now let's talk about us. Let's talk about the caregivers, right? What do we need? So number 1 is going to be snacks. I would definitely keep some trail mix, some peanut butter and crackers, anything that can stay in the bag for a little while. Just keep them in there, granola bars, okay? And this is so if maybe this happened, you missed a meal. You don't want your blood sugar to get low. You need to be on your A game. You need to have as much energy as you can. Plus, you don't want to leave your loved one, right? So having a snack available, you just never know. I mean, I've literally been through hospitalizations where I've been snowed in, so I couldn't even leave. It was a blizzard. And then because of the blizzard, the cafeteria was shut down. So there was no food at all. It's terrible. So having some food in your go bag is important. Number 2, put in that book you've always wanted to read, or that magazine that you just never get to look at. Put that in there while your loved one's resting. Once they get comfortable, once they get stabilized, it's okay to be distracted. It's okay to look at that book or that magazine. That's all right. A charger. If you have an extra phone charger to spare, keep your phone charger in there. That's terrible. Been there, done that. Didn't realize that a doctor's visit would turn into a hospital, an all-night hospital event, and about 2 hours from home with no charger, and everybody at home wondering what's going on, what's happening, how do I find you, which hospital did they send you to? And it's like, oh man, if I only had a cell phone charger, right? So keep a cell phone charger in there if you can. I always like to have in there too, like a sweater. I know that seems really weird, but it's important for you, again, to be on your A game. So being comfortable, being hydrated, having food, all of those things is going to make you a better caregiver, right? And so if it's cold, which it normally is in those ERs, having a little sweater is just going to make you, again, more comfortable. I would also consider a change of clothes. Again, I can't tell you how many times I've had to stay overnight in the hospital unexpectedly. So a change of clothes is always, always nice to have on hand. Just makes you feel better the next day. It really does. And lastly, I would have in there your favorite stress relieving essential oils. Now, you do need to make sure that your oils are CPTG. This is for everybody's safety. You don't want to cause any harm, right, by using a synthetic oil. You want to use a pure therapeutic grade oil that has an effective outcome. And I have to tell you that there's been so many times where myself and my loved one were utilizing these oils in the room and for de-stressing, for taking away the anxiety, also for immune boosting, which is super important in that environment. And nurses will pop in. I'm like, oh, did you need something? And they're like, no, it just smells so amazing in here. I'm just coming in here to relax before I go to my next patient real quick. So it's really powerful, really incredible. And again, if you go to my blog, www.bethanyratcliffe.com, you can, again, under the resource tab, take a look at what other essential oils that I use and also reference this entire blog article there with the essential oils, with that completed medication list. Okay, so listen, the average ER visit is between 4 and 6 hours long. If they have to be admitted, you're just going to be ahead of the game. And if it's at a surgical center, you know, maybe you have one of those visits where they may not have the special supplies. Again, you're going to be prepared. You're going to be organized, prepared. It's going to be so much more efficient for you, for your loved one, and gives you a tiny piece of control in a situation and in this journey that is sometimes very uncontrollable. It's the easiest thing we can do. It's the easiest thing we can do, just being prepared. I really hope that you got some value from this, that it made you think a little bit more about some easy ways and easy things to implement what I shared with you. And I hope that you stay connected to me and that we can celebrate together this caregiving journey.